Coughing is a natural reflex of the body that helps to clear the throat and airways of irritants, mucus, or foreign particles. It serves as a protective mechanism to prevent these substances from entering or lodging in the lungs, which could potentially lead to infection or other respiratory issues. There are various reasons why we cough. 1. Irritation. When the throat or airways are irritated by dust, smoke, fumes, allergens, or other particles, the body responds by triggering a cough to expel these irritants. 2. Infection. Coughing can be a symptom of respiratory infections such as colds, flu, pneumonia, or bronchitis. Infections cause inflammation in the airways, leading to increased mucus production and irritation, which triggers coughing. 3. Allergies. Allergic reactions to substances like pollen, pet dander, or certain foods can cause coughing as the body tries to remove the allergen from the airways. 4. Smoking. Smoking damages the lungs and irritates the airways, leading to chronic coughing. Smokers often experience a persistent cough as a result of the toxins in cigarette smoke. 5. Medical conditions. Chronic conditions like asthma, chronic obstructive pulmonary disease COPD, gastroesophageal reflux disease GERD, and postnasal drip can cause persistent coughing due to inflammation, narrowing of airways, or excessive mucus production. 6. Medications. Certain medications, particularly those for high blood pressure, called ACE inhibitors, can cause a chronic dry cough as a side effect. 7. Environmental factors. Cold, dry air, or sudden changes in temperature can also trigger coughing in some individuals. In most cases, coughing is a temporary and beneficial response that helps clear the airways. However, persistent or severe coughing should be evaluated by a healthcare professional, as it could be a sign of an underlying medical condition that requires treatment. Please comment what you want in my next video.